My name is Martha Khlopin, and I've been invited to do this Medicare series, and I think it's so important because for a lot of folks, Medicare can be a lot to understand at the time they become eligible for Medicare. And sometimes, even when people already have Medicare, they're still a little bit confused about how it works. This past weekend, I had the pleasure of being at the walk in Arizona at the stadium. So I just got back yesterday, back to Hawaii. But we had about 20 people stop by our table because we did have a table there and we were available to answer questions. But 20 people stopped by, and out of the 20, only one person could tell me what insurance plan they had. So I said, my question was, what insurance do you have? And they said Medicare. I go, okay, so what kind of Medicare plan? And only one person knew that they had a Medicare Advantage plan. And the other ones all had Medicare supplement plans, but they didn't know that. They didn't know there was a specific name for the type of plan that they have. So one of the most important things, in my opinion, is we all should know what that little card is in our wallet or our purse, because when there is a need for services, what health plan you have, especially when you move over to Medicare, makes a huge difference. So my presentation today is called Got Medicare, What You Don't Know You Need to Know About Medicare. And maybe everything that I will share will be things you already know. But if you don't, I'm happy that I'm able to share this with you. And the foundation has made me a resource for you.
And
Have
Martha, just
oh,
before you jump in, I just want to kind of introduce you a little bit
oh,
to
I'm sorry.
people. No, it's great. I'm so happy that you jumped in, and we're so thankful that you dedicated your time to going this weekend and being there, and getting to meet a lot of the patients that are involved with us face to face. So thank you for that. And I just want to read a little bit about Martha's background before she jumps in so we can all get to know her a little bit better. So Martha is a trusted voice for older.
That's great.
Oh. So Martha is a trusted voice for older adults and their families. For more than a decade, she's hosted the weekly syndicated radio program, A Medicare Moment with Martha, and a Millennial, and a Oleo television show. She also appears monthly on Living 808, where she translates Medicare eligibility and enrollment rules into clear, practical guidance. Beyond media, Martha leads community workshops that help families successfully navigate government programs. She also has co-authored peer-reviewed articles in medical journals, including work published in the Lancet Oncology. A graduate of New York University, Martha has lived in Hawaii for 25 years and is married with 2 children, one of them who we just met. So without further ado, I'll hand it over to you, Martha.
Oh, thank you so much for that introduction. And sorry, I jumped the gun. I was so focused on the tech. But yes, I'm happy to be here and share information and answer questions. So I always have to make sure everybody knows the information I'm presenting today is purely educational. It's used to give you some, exposure to how I believe you have to navigate Medicare, but you always want to reach out to Social Security and Medicare. They are your sources when you want to speak about your specific situation. Somebody who was on the presentation last time, he said, oh, you don't go into specifics about plans, and that's correct. I'm actually prohibited from doing that when I'm doing an educational presentation. So if somebody wants me to talk about is one plan, maybe better than another plan, that is a separate conversation that I have to have with you. And I actually have to have you sign something stating that you want me to talk to you about how different plans will operate. So this is purely educational. Now, everyone, believes they know what Medicare is, and maybe you've heard of it, maybe you know the definition, but it is a federal health insurance program. So right now, what do we have? A federal shutdown. So that does impact a lot of different federal agencies, but I'm happy to say that Medicare and Social Security are still operating even during the shutdown. So it is a federal health insurance program. People become eligible once they lose their employer plan, or sometimes people have never worked. So they don't have an employer plan, but Medicare becomes available when you're at the age of 65, no longer have an employer plan, or some people have disabilities and they qualify for Medicare at any age. I once did a seminar, and there was a husband and wife, his parents, and their child, and all three, or I should say, each person, it was five, they all had Medicare. So the 1-year-old was born with some kind of a health issue that he qualified for Medicare. Both parents were on Medicare, and the grandparents, due to age, were on Medicare. So age is not the only reason that some people qualify for Medicare. Now, benefit decisions are controlled by the U.S. Congress, and Social Security Administration handles the enrollment and eligibility. Now, normally when I do this in person, I do ask people, do you know who runs the Centers for Medicare and Medicaid? So if, you know, you can open up your mic. Does anybody know who is responsible for Medicare? Can't. So I didn't hear anything, and that's okay. So it is Dr. Oz. So if anybody remembers watching TV, you got to show me how to do it. If anybody remembers watching TV, there was a Dr. Oz show. Dr. Oz is the person who is responsible for managing the Medicare program. So if you have issues and you're wondering why something works the way it does, it's Dr. Oz. I'm sorry, oh. I can't do it. Can you do it for me? Thank you. I have to have my techie help me. So where and when do you learn about Medicare? Most people, the first time they learn about Medicare is they've heard about, you know, maybe a webinar, or somebody's having a meeting. So they tend to learn about Medicare from salespeople. And of course, there's nothing wrong with salespeople. That's, you know, a job. But to me, before you start deciding about what Medicare plan you'll choose, you need to learn about Medicare. You need to know how it works. You know, what's the difference between an HMO and a PPO, in network and out of network? You don't want to learn this once you have a diagnosis that's going to require a lot of medical treatment. So I believe that this is a wonderful, you know, opportunity for folks to really learn about Medicare. Even for people sometimes who have had Medicare for a while, they tend to say that they've learned something. Sorry, Elliot, I took that off. They learn something when they're in that Medicare stage. So with Medicare, unlike employer coverage, there are 4 parts to Medicare: Medicare Part A, Medicare Part B. Medicare Part C is when you pick up your Medicare, instead of directly from Medicare, you pick it up from a private insurance company. When you pick up Medicare through a Part C plan, you have assigned your Medicare Part A and your Medicare Part B to that private insurance company. They call that a Medicare Advantage plan. And many times that will include your drug coverage and a lot of other things that they throw in. But Part C is, when you see Part C, what you know is that you have Medicare through a private insurance company. So your Part A and Part B are put into this little box, and now you have your Medicare coverage through that private insurance company. So that insurance company handles all of the claims, and that insurance company actually gets paid by, I'll just say, Dr. Oz. They get paid by Dr. Oz to administer the Medicare benefits. So I have had people who didn't realize that they have their Medicare through an Advantage plan, and they have a hospitalization unexpected, and a family member or friend that means well shows the hospital their Part A and Part B card, and then months later, you know, they have this hospital bill and they don't understand why. So I've been able to say, hey, you know, you have a different kind of plan. You need to get that Part C card over to the hospital, and that will take away that huge bill and that denial. And you'd be surprised, a lot of people run into situations like that, and no one bothers to tell them that they showed the wrong card, because how would the hospital know if you have a Part C plan? A lot of people think there's like one big supercomputer somewhere, and maybe there is, you know, that has all this information. But it's been my experience that when you go to a hospital, you go to the doctor, they don't necessarily have any kind of mechanism to determine if you know, you ended one plan yesterday and you started a new plan today. They just don't have that kind of access. So it's very important for you and anybody that you love and takes care of you to have the correct insurance cards. There's also a Part D of Medicare that just came around in 2006. When Medicare started back in 1965, there was no prescription drug coverage under Medicare. You know, sometimes I hear people saying, oh, these prices are so high, and they are correct for Medicare copays sometimes. But in 2006, this is when the program started. Prior to that, there was no prescription drug coverage. You had coupons and you relied on pharmaceutical companies to give you a break if you were low income, but most people were paying 100% out of pocket for prescription drugs before 2006. There's also a type of plan called a Medicare supplement plan. This plan, this is not a part, this is a plan, but Medicare supplements come in plan, not parts, but plans A, B, C, F, G, N. It's a just a lot. But Medicare supplement plans are the type of plan that works alongside of your original Medicare Part A and B. I tell people, think of it as secondary coverage. So whatever Medicare Part A and Part B don't cover for a particular service or treatment, that's where your Medicare supplement will come in. Now, Medicare supplements do have a monthly premium. And that monthly premium is determined by a lot of different things depending upon the one that you have. But a lot of people confuse those with the Medicare Advantage plans, Part C, that many of them are advertised as $0 per month. Another way to know whether you have a Medicare supplement or a Part C is if you have a 0 monthly premium plan, you don't have a Medicare supplement plan. So if you're unsure, that's one way to know that, you know, I probably don't have that. Oh, did somebody have a question?
Yeah, I had a question,
Oh, sure.
Martha. Well, first of all, do you want to take questions as you make your presentation, or do you want to take questions at the end?
Well, if we have a small group, you know, you can
Well,
stop
there's
me.
only 10 people on, so.
Yeah, so that's fine. Yeah, you can reach out.
Okay, well, then let me ask a question.
Sure.
I'm a little bit confused, but I'm 75 years old, and when I signed up for Medicare, I was advised by, and please, I don't want to prejudice anybody, but I was advised by a hospital administrator that I was playing golf with that I needed to go to Plan F.
Mm-hmm.
And they don't offer Plan F anymore because it was too expensive for the government. They offer Plan G. And then I heard the other day whether or that there was a Plan N or M, and I didn't know what that was. Could you explain that, please?
Sure. And thank you very much, Michael, for your question. So first, let me go back for a second. A hospital administrator advised him to sign up for the Medicare Supplement Plan F as in Frank. A lot of people think that it went away. Plan F did not go away if you turned 65 prior to January 1st, 2020. So anybody who turned 65 before January 1st, 2020 can still sign up for a Plan F as in Frank. We
That
have
is great information.
what was that?
I said that's incredibly
Yeah.
good information.
Yeah, quick story. We had a gentleman who his home burned down in the fires in California. So he relocated to Hawaii where he was born, and he was 80 years old. So he had always had a Medicare Advantage plan. And he said, hey, I'm getting older. I probably need to go ahead and sign up for a Medicare supplement plan. But I heard that I will never get approved. So we said, well, it doesn't hurt to apply. So he applied with us, and he got approved, and it wasn't he didn't get what we call rated. He got a reasonable rate at 80 years old. He got a Plan F as in Frank for, I think it was $290 per month, and that will work alongside of his A and B, and he'll have zeros for Part A and Part B. So a lot of times there's a lot of bad information floating around out there, and that's why I'm so happy that the foundation has invited me to do this, because it might help somebody who you say, hey, you need to get on this Plan F, but only if that person turns 65 by January 1st, 2020. Plan G is the most comprehensive plan after F. This is available to people who qualify, who turn 65 after January 2020. They can pick up the Plan G. The only difference between the Plan G and the F, besides how much you pay per month, is the Plan G, you have to pay the Medicare Part B deductible. The Medicare Part B deductible in 2025 is $257. So once you meet a $257 one-time annual deductible in the Plan G, all benefits work exactly like the Plan F. So Plan G is still a really good option for people who are looking for the Medigap Medicare supplement plan as a way to get their Medicare. Michael, you also mentioned Medicare plan. It's N, not M. N as in Nancy or Niagara. And Plan N is very interesting. You still have to pay the $257 deductible. And again, that's 2025 Part B deductibles change each year, but you still have to pay that. However, you also pay $20 when you see a physician. So whenever you go for services, you're also paying a $20 copay in the Medicare supplement plan N as in Nancy. Now, everything else works very similar to the Plan F and the Plan G, but there's one more issue. The other issue with the Plan N is it does not take care of what's called excess payments. So some people are unaware that when you have Medicare and you see Medicare providers, the provider can take what's called assignment. If the provider takes Medicare assignment, what that means is whatever Medicare decides to pay for a particular treatment or service, that doctor accepts that. However, some doctors take Medicare, but they don't take assignment. What does that mean? That means they can bill you up to 15% more than Medicare allows for that treatment or service. So in the Plan F and the Plan G, excess charges are covered 100%. You're not responsible for them. But in the Plan N, as in Nancy, they do not cover the excess charges. So if you look at a Plan N, you need to make sure you understand, number one, you will pay the Medicare Part B deductible, which this year is $257. I heard it's going up to $288 next year, but I don't have confirmation. Then you would also have to pay $20 when you see a provider. And lastly, because it does not cover excess charges, if you were to see a provider who does not take Medicare assignment, that provider could bill you 15% more than above what Medicare charges. So that's the breakdown of the Plan F, Plan G, and Plan N.
Okay, additional question. The reason when I was playing golf with this guy, he told me to go to Plan F at the time. Now, this was 10 years ago. He asked me if, and I'm not endorsing this hospital that I'm going to mention, but he said, well, if you get sick, do you want to be able to go to Mayo? And I said, well, yeah, of course. I mean, we're in Phoenix. We have a Mayo here. Why wouldn't I want to do that? And he said, if you go to Medicare Advantage, they don't take Medicare Advantage. And when the salesman came to sell me or to get the policy that I was getting ready to purchase, he was pushing toward Medicare Advantage. And I said, well, I can't go to Mayo. And he said, well, you know, it's $600 less. My comment was that my wife spends more than that on shoes a year, but you know, that may not be everybody. And so what we have seen on these calls, and this is really a long question, Martha, but where we see on these SOS calls, people in Medicare Advantage plans seem to be locked in to a network of doctors that they can't get out of. They have to go to that specific doctor, or, and please correct this if I'm wrong, or you then have to pay an exorbitant amount to see them, which is whatever there's posted in their office or the hospital. Is that correct?
Okay, so let me just take that in parts.
Okay.
So some people, you know, have selected Medicare Advantage plans. And I will let everyone on this call know that when I mentioned before that when you go to that Part C or Medicare Advantage plan, Medicare pays the insurance company for you to be in that plan. In Honolulu, it's about $1,000 per month per enrollee. And we have in Hawaii over 120,000 people on Medicare Advantage plans. So if you do the math, 1,000 times 120,000 people every month, pretty huge numbers. So with that, they can pay sales agents to market their Medicare Advantage plans. So many times, agents lead with the Medicare Advantage plan. But like your hospital administrator friend told you, because the network sometimes can be limited, Medicare supplement plans work very well if you've had a certain diagnosis and want to visit certain centers who may not take your Medicare Advantage plan. Now, let me, go back to the Medicare Advantage plan. Let's say you have a Medicare Advantage plan and you do need to see different providers. Well, depending upon the type of Medicare Advantage plan you have determines who you can see. So if you have an HMO Medicare Advantage plan, that's the Health Maintenance Organization plan, you must stick to the providers in that network unless there's an emergency. But people have even had a hard time getting their HMO to pay an emergency. Yes, Michael?
Well, that's where I'm going with this is
Yeah.
what we preach in our calls is that you need to see a pancreatic cancer specialist who's
Right.
an oncologist who is a pancreatic cancer specialist.
Right.
And in some of the HMO, I don't know about PPO, which I'm assuming you're getting ready to comment on,
Yes.
they
Yes.
don't have a pancreatic cancer specialist and they will not refer you out. So then you can't get you're just seeing a regular oncologist that treats skin cancer, nose cancer, foot cancer, and whatever other
Right.
kind of cancer.
Right.
And you don't get the advantage of seeing a specialist. Now,
Right.
am I off base on this
Right.
or?
Well, not off base, but you have to make the distinction between the HMO, Health Maintenance Organization, and the PPO, which has different rules. Okay, so that's what I'm going to just cover real quickly because it's not part of my presentation. So with the HMO, if you were in an HMO and they truly did not have a specialist that you need to see, there is a process that you could request that you are allowed to see someone outside of the network. But certainly when somebody is experiencing, a health, situation like that, a diagnosis like that, you may not be able to do that heavy lifting. But there are rules that say if there is a specialist that you need to see that is not in that network, you do have a right to appeal. But if I move over to the
Wait a
P,
minute. And
oh,
who makes that decision? The
it's
government?
still the insurance
So
company,
the
but you
insurance company is
you
making
do
the
have a right.
decision whether you need
Yes.
to see a specialist if they have an oncologist.
That's correct. That particular, if you need somebody with a particular specialty. And it's the same thing, over on the PPO side. PPO allows you to see in-network and out-of-network providers, even though out-of-network will typically cost you more. But with a PPO, you do have more flexibility than with an HMO. So PPOs, if somebody is in an HMO, they may not be able to go to a Medicare supplement plan, which in this particular scenario would be ideal, but at least during the annual enrollment period, they could change to a PPO, which does give you more flexibility. But let me say something about that. Just real quick, I just had a person call me 2 weeks ago, and she was with UCLA under a clinical trial for a cancer. And she was told that, you'll continue to have benefits under your clinical trial, but we no longer take your Medicare Advantage plan. That was UCLA. And then it was so interesting. The very next day, I got a notification that Mayo Clinic had dropped Humana and also United Healthcare Medicare Advantage plans. So in this particular case, she, for care that she still wants to get at UCLA, she has a PPO, so she still can be seen at that UCLA location for things outside of the clinical trial, but she has to pay first and get a reimbursement. Okay, so on an HMO, nothing, but with the PPO, she will still be able to see providers there, but she has to pay first. And just like with the HMO, if there's a provider that you need to see, that as long as they take Medicare, even though you have a Medicare Advantage plan, you should still be able to see the provider, but you may be responsible for, reimbursed. And the last thing I want to say on that is also with Medicare Advantage plans, because Michael, some people, they do have Medicare Advantage plans, and I've been talking to a few of them, and I don't want them to get too frightened because they absolutely cannot change to a Medicare supplement plan because they would never pass the underwriting. But if they're in a PPO, there's a maximum out of pocket for these PPOs. So one that I'm thinking of, it's a $10,000 out of pocket. So at least we know if the service is, if it's Medicare approved and they receive the pre-authorization. And like you said, Michael, the insurance company has to make that decision. But if they get approved and it's pre-authorized, everything's good, the maximum they'll pay is $10,000. So if they had $1 million, the maximum they will pay is $10,000 in the PPO type Medicare arrangement. But just as you said, the Medicare insurance, the private insurance company does get, they're managing your care, so they do get to be a part of that decision. So if it's a no, you can appeal, but there's no guarantees. But if that service treatment is approved and it's authorized, then the maximum you'll pay is whatever the maximum out of pocket is for that plan. And I've seen them this year, for 2026 as high as 13,000, but they run somewhere between 6,700 and $13,000. Once you hit that maximum out of pocket, you don't have to pay anything additional.
No, now the one question we get a lot of, okay, that I really want to clarify is,
Okay.
let's say that I went to a Medicare Advantage plan, okay?
Mhm.
And I'm 67 years old and I get pancreas cancer. And now I'm going, oh, I want to go to Mayo Rochester. I mean, I don't know what Mayo Rochester takes or doesn't take. This is just an example. And I'm in the enrollment period. Okay, so I already have an Advantage plan, but I'm in the enrollment period, and I go, well, I don't want this anymore. I want to go to Medicare Part A, B, and I want to make the person old enough so, and I want to get whatever that age would be, I guess. But I want Plan G, let's say.
Okay.
Okay, so can I do that?
Okay. So let's talk about that. So Michael, you're talking about enrollment periods. So there's a different enrollment period for Medicare Advantage plans. It does not relate to the Medicare supplement plans at all. So right now we're in what's called Medicare annual enrollment period only for Medicare Advantage plans or prescription drug plans. Does not relate whatsoever to a Medicare supplement plan. So if someone wanted a Medicare Plan G supplement plan, all right, if they were within 6 months of picking up their Part B, or they retired and lost employer coverage within 6 months, that is their guaranteed issue period. Also, they call it the open enrollment period, but guaranteed issue open enrollment period. That's it. There are no annual enrollment periods for Medicare supplement plans, but people get that mixed up all the time. So in this particular case, if this person is 67 years old and they've been, lost their employer coverage or they picked up their Part B more than 2 years ago, in many, many states, about 45 states, they are subject to underwriting. What does that mean? They will want the name of the person's primary care doctor, any specialist. They have a long application that wants to know how many hospitalizations you've had, what is any diagnosis you have you been told you need surgery, have you had cancer? They ask a lot of questions. And if you answer the questions, yes, you will likely not be approved for the Medicare supplement plan, you can be completely denied. So the only guaranteed issue enrollment period for a Medicare supplement plan is within 6 months of turning 65 and getting your Part B, or within 6 months of losing an employer plan. New York is a state, no underwriting. You can pick it up at any time, but you have to check the rules of your state. Here in the state of Hawaii, you're 6 months. You know, California, you know, a lot of the states that I work in about 40. You have to meet that requirement that you're within 6 months of getting B or you lost employer coverage.
Okay, now I want to make sure I understand this. So
Okay.
let's make me 75 years old, okay?
Okay.
And I'm in Medicare Advantage.
Okay.
I haven't lost my employee coverage because I'm retired, okay? I just happen to have a Medicare Advantage plan. I'm retired. I'm outside, I think, that 6-month period that I'm not understanding completely, but I'm outside that 6-month period and I go, oh my God, I just got pancreas cancer. The Medicare Advantage plan that I have will not let me go to the Mayo Clinic in Rochester, which is in our example that we're talking about. I want to go to Medicare Part A and B and buy a supplement. Can I do that?
Okay, let me just rephrase that. So we just had a case like this, and the gentleman is 75 years old. The gentleman is has his own independent investment advisory practice, and he was just diagnosed with a very serious condition, and he had a Kaiser Advantage plan. And it just was not working out since he got this new diagnosis. But because he's still working, what we were able to do is get him, you know, he had to go through the full underwriting, but because he has an employer plan, and they count that as a reason to be able to get guaranteed issue, he was able to get into Medigap. He was able to get Plan F as in Frank because he turned 65 before 2020. So he was able to get into his into a Plan F.
Okay, but your answer relates to an exception. If he wasn't
Yeah.
employed, would he have been able to do that?
No, no, as I said before, the period is 6 months within 6 months of getting your Part B or within 6 months of losing your employer plan, and then you get guaranteed issue. Outside of that, no.
So you're
No.
stuck in Medicare Advantage forever and
That,
ever.
that is correct. So at least pick up a PPO to give yourself more flexibility. Correct.
Okay,
Is
now my next comment is a commentary, not a question. I wonder
okay.
who got that rule passed. I'm sorry.
Yeah, it's interesting, isn't it? Yeah. Yep. So I will continue unless you have
Please,
anything else you
sorry.
want to share. So it's important to know who pays first when you have Medicare. If you have retiree insurance from a former employer, Medicare pays first. Sometimes people don't realize that Medicare pays first. I experience this with people. They retire and they have insurance for people under 65. Once they turn 65, that same retiree coverage continues, but now they need to pick up their Part A and Part B. Believe it or not, sometimes people don't do that. So that retiree insurance terminates. And the only time they learn about it is when they go to the doctor and they say, oh, you don't have any insurance. So it's important to understand that once you move over to retiree insurance, if you're age 65 or older, you need your Medicare Part A and Part B for most retiree plans. If you're 65 or older and you have a group health plan based on your own or a spouse's current employment, and the employer has 20 or more employees, your group health plan pays first. So whether you pick up your A only or your A and B is entirely optional, entirely up to you. The next area, if you're 65 or older, have group health plan coverage based on your own or a spouse's current employment, and the employer has less than 20, Medicare pays first. So I've run into a lot of cases where people were, you know, believe it or not, doctors, independent, you know, practitioners, chiropractors, dentists, they have a small office, 2 to 5 people. They turned 65. The doctor never picked up his Medicare Part B because he has employer coverage and he thought he was okay. And he's not okay. And you'd be surprised that, the doctors that, just can't even believe what I'm telling them. Like, we're doctors. How come nobody told me? And what we do is we help them to get their Medicare Part A and B so that they can be compliant and have their bills correctly paid. Because just because you may not have been aware that you're required to have Medicare first, even if you have other employer coverage, even if you have COBRA, just because you don't know, when a big bill comes in, that's when you'll find out that your, employer plan doesn't have to pay because you don't have an exception, your company is less than 20, and you were supposed to pick up your Medicare Part A and B the first day of the month that you turned 65. My case, fun, well, I shouldn't say fun, but a case that uh, I enjoy working with, where I was able to help an 89-year-old doctor who'd been a real blessing to our community. He ends up at 89 and he has to have this medication called Opdivo, which was $16,000 every two weeks, $32,000 a month. So his group employer plan reached out to him and said, "Doctor, are you still practicing?" And he said, "Well, I take care of my friends and family members." And they said, "Well, doctor, we need to see your payroll because you have a group health plan." So he said, "I don't have payroll. I don't charge anybody." And they said, "Well, doctor, you can no longer have your group health plan if you don't have a payroll." And they proceeded to tell him that he was going to have to, starting the first of the following month, you pay for his $32,000 a month medication. So his son, 51-year-old son, got a hold of me, and I was able to, work really quickly to get him his Part B. And because that was his first time getting his Part B at 89 years old, he got a Medicare Supplement Plan F, and we were able to get that Opdivo. Instead of $32,000 a month out of pocket, he was able to get, the supplement plan covered it at zero. So it really is important to understand, how insurance works and who's primary and who's secondary and all that. This information is really super important, you know. So I'm going to run through this pretty quickly because we lost a little bit of time. But one of the other things that I think is challenging for people is there is no public facing Medicare office. There is none. Yes, there's Social Security, but there's no public facing Medicare office. Once you have Medicare, you're on the phone to 1-800-Medicare, or you're talking to friends and family or front office people, and you don't know what their understanding of Medicare is. Sometimes even people in the hospital system don't know how Medicare, the little nuances of Medicare. And again, that's why I'm so happy I have this opportunity to start talking to you about this, and we can create other educational programs, because I've been doing this now for 15 years for any particular area of Medicare you want to talk about. But this is just a quick overview, just to, let folks know that maybe some of the information you have has not been correct. Now, you do start the process at the Social Security office. A lot of people have been calling, "Martha, there's a shutdown. I know Social Security is closed." And I tell them Social Security is not closed. As a matter of fact, when I have to call Social Security now, I used to be on hold for 45 minutes to an hour and a half. I'm not exaggerating. But because people think that Social Security is closed, when I call Social Security now, the local office, I can get a response in 4 to 5 minutes. So the Social Security number I call is not the national number. Whenever I'm talking to somebody, they can be in New Jersey, they could be in Iowa, they could wherever they are, Salt Lake City, Utah. I get a lot of calls from Utah. I always find the Social Security office number closest to where they live, and we call that office. And now I'm able to get through very quickly, and I know it's because of the shutdown. I like showing this card because, again, a lot of people just put this card away and never think about it again. But one of the challenges that some people have is when they go on to Medicare and they get the Medicare card, they don't realize that if they have a Medicare supplement plan, like what Michael was sharing about earlier, you would show this card first. You provide bills, original Medicare, and then if you have the secondary Plan F, Plan G, Plan N, then as soon as Medicare pays the bill, The secondary Medicare supplement plan doesn't get to ask any questions. They have to pay the difference. And then for most part, you have zeros. If you have a Medicare Advantage plan, some people pull out this card. They give it to the hospital, they give it to the doctor. That claim will be denied because when you have a Medicare Advantage plan, the government, Dr. Oz, is now paying that private insurance company to cover all your bills. So when you have a Medicare supplement plan, this is the card that you lead with. If you have a Medicare Advantage plan, it's whatever card comes from the private insurance company that's getting paid by Dr. Oz to administer all of your Medicare benefits. Now, some people, they may not be, they may already be enrolled in Medicare, so they don't need this little primer on how to enroll. But there's only, two ways to enroll if you are coming up to Social Security age, Medicare age rather, and you're you're not collecting Social Security benefits. You have to enroll online at www.ssa.gov, or you have to call them and make an appointment. They'll call you at a designated time and they will enroll you in Part A, if that's all you want, or Part A and B. This part is from the government, which is totally separate from choosing a Medicare supplement plan or a Medicare Advantage plan. And this is another area where people get really confused. To make it worse, if you're over the age of 65, you have to prove that you had continuous coverage from age 65 or incur a penalty. The way that you do that, you have to get a form from your former employer to show that you had continuous coverage, and you have to fill out a form and get both of those over to Social Security. My most interesting case with this is there was a gentleman, and he had 4 jobs from the age of 65 to when he was ready for his Medicare insurance. He said, Martha, do I really have to go get a form for every single employer? And I said, yes, you do. And he said, well, 2 of those employers, I did not end on good terms. And I said, doesn't matter. You have to go and get those forms completed. Turns out one of those employers had gone out of business. So he said, well, what do I do now? And I said, well, you have to go back to the insurance company that you had the employer coverage with, and they can generate a letter for you. And that's what you have to provide to Social Security. So he did that, and he was able to go and get, onto his Medicare Part A and B. These are the forms. I just briefly like showing these forms because a lot of times when you look online or you call, they'll tell you you need these 2 forms, but people don't have any idea what they look like. So if you're over the age of 65 and you need to sign up for your Part B because you had employer coverage and didn't need it, these are the forms that you need to complete. When I generally have issues with people like this, if they get, again, a significant diagnosis, they were on the employer plan, never ever thought about they would need to get their Medicare, and they're unfamiliar with these forms. Well, the Human Resources Department, their job is not to tell you how to work with Social Security and Medicare forms. So you are left to go and find these forms yourself, or as I said before, call Social Security and make an appointment. So I always like to show those forms. Now, again, there are 4 parts to Medicare. There's the hospital, the medical, the Part C, which is like the cable package, and then Part D drugs. People who have a diagnosis that they will need a lot of medical treatment, a lot of doctor visits, CT scans, MRIs, things like that. It's great when they can pick up the Medigap plan, also known as Medicare Supplement Plan, because under Part A, if you can see, it might be a little small. It shows deductible of $1,676. So if you had just Part A, you would have to pay that deductible. But when you pick up a Medigap plan, the Medigap plan takes care of that deductible. Under Part B, there's a small deductible as well. If you have the Plan F, then you're not responsible for it. But if you have other Medigap plans, you will be responsible for that deductible. So it's just important to know on this slide that, Medicare premiums change, the deductible can change each year. Even the Medicare Advantage plans have changes to their copays and their coinsurance. A lot of people, believe it or not, they call me and they think when they go into a Medicare supplement plan, whatever the cost of that plan when they enroll, that it will always remain that cost. But I go, nope, it can change every year. and just be prepared for it. But just remember, with the Medicare supplement plan, you're paying every month to basically get zeros for all of your care. Now, as we talked about before, with Medicare options, you have the choice to get the original Medicare A and B, a Part D, and a Medicare supplement plan. I just want to stay on this for a moment because I said before that Medicare supplement plans only have a 6-month guaranteed issue in most states where you can get it, no questions asked. Otherwise, you're subject to underwriting and you might not get approved. So there is no annual enrollment period where you get to switch and choose. However, when you have a Medicare supplement plan, that right in the middle where it says Part D, that is a plan that you can switch each year from this October 15th through December 7th. And the reason that this is important for you to know for this year, well, coming up 2026, I've been looking at the Medicare Part D options, and most of the plans that I look at for the Part D, they have increased the deductible. This year, I've seen deductibles as low as $340, maybe $400. Next year, $600, $615 deductibles. So you don't want any sticker shock. You want to make sure you understand how your Part D prescription drug plan works. Also, what I've noticed is, in case you may not know this, not all Part D plans cover the same drugs. They all have what's called formularies. And for 2026, this is the first time that I've seen some pretty, significant change in the formulary. So you want to make sure that all of the medications that you take are covered under the drug plan in 2026. Now you might think, oh, they covered them this year, so surely it covers next year. But what I've been finding is medications that were covered under your drug plan in 2025, they're not on the formulary in that same drug plan for 2026. So this is an area that you do need to take a look at your Part D plan. You want to make sure you check all the medications. That's what we've been busy doing since October. We've been, asking our clients for their medications, frequency, and dosage. We've been putting it into a plan. It's called Plan Finder, and it tells us what Part D drug plan is going to cover those drugs at the lowest possible cost. So Part D is something, even if you have a Medicare supplement plan, every year you should be looking at how the Part D plan for the new year is going to cover your existing drugs. On the other side of the coin, in the Medicare Advantage plan, if a Medicare Advantage plan, doesn't take your doctor, or, you got to look at the doctors as well as the drugs to make sure that in the new year, the plan does cover your doctors and your medications. Now, each year, Medicare requires Part C plans and even Part D plans to send you what's called an annual notice of change. That will show you how your plan covers services and medications in this year and what it will look like in next year. A lot of people overlook it, but that's a very, very important document to help you make a decision as to whether you need to make any changes or you can stay where you are. Now, Medicare Advantage plans that we were talking about earlier, Part C, that's that all-in-one bundle. You get your Part A benefits, your drugs, dental, vision, hearing, and many times it's $0 per month. What's the drawback? Well, this is a managed plan, so if you need to have an MRI, your doctor might have to reach out to your Medicare Advantage plan to get authorization. And the Advantage plan can say no. The Advantage plan can say, well, Martha gets the MRI, but somebody else does not. So that's what a lot of people are concerned about. When you have a Medicare Advantage plan, you get another level of bureaucracy. It's not just Medicare determining if you can have a particular procedure or service. So with Medicare Advantage plans, you do need to understand there's another level of bureaucracy. The reason they throw in the dental and the gym membership and the vision, all these additional things, because they want to attract you to the Medicare Advantage plan. And I will say, in working with many of the companies that offer them, they actually want to keep you healthy. If you get a certain diagnosis, what can you do? But these plans want to keep you healthy, because if you are not seeing a doctor and picking up a lot of medications, they get to keep more of what I'll say Dr. Oz, he represents Medicare since he runs it now. They get to keep more of what Dr. Oz pays them on a monthly basis to have a Medicare Advantage Part C member in that private insurance company's plan. So that's why you have that all-in-one cable package type of plan. However, that private insurance company is managing your care, and not everybody on the plan can all have MRIs at the same time. We all can't take the most expensive medications all at the same times, and that's why pre-authorizations are required for many of the services and some of the treatment within a Medicare Advantage plan. In the Medicare Supplement plan, which is another way to get your Medicare, and you cannot have both at the same time, this one, your Medicare Part A and Part B are working alongside of the Medigap plan, which I say the best way to look at it is as a secondary coverage. It will fill in the gaps of your Part A and B, but it's more a la carte. So if you want dental, hearing, or drugs, those are add-ons that you need to pick up to work with your Medicare. I did have a person once, and he was on a Medicare supplement plan. He goes, Martha, I'm just used to just getting up and deciding that I want to call my eye doctor and get a routine eye exam. And he said, my Medigap plan doesn't pay for that. And I said, that's correct. I said, if you have red eyes, itchy eyes, watery eyes, yes, that would be covered, but a routine eye exam is not covered by a Medicare supplement plan, because in order for your Medicare supplement plan to pay a claim, Medicare has to pay first. And original Medicare does not pay for a routine eye exam. A lot of people don't get that, but that's the rule. I work on the rules. A lot of folks sometimes are still working when they go on to Medicare. So they say, should I keep my employer plan? That's entirely up to the individual. But what I can say is both plans will work together. So if you work for a company with more than 20, employer plan is going to pay first. The any Medicare option you pick up pays second. If you work for a company less than 20 and no exception, then Medicare will be on top of the employer plan. So you can keep both and they will just coordinate. Here I always provide this number. It's called Benefits Coordination and Recovery Center. And that's for people who already are, have a Medicare option. If you ever have a problem and the provider says, oh, this is denied because we don't know who's primary and who's secondary, instead of getting a hold of just 1-800-Medicare, you need to call this specific number. And if you call this specific number, 855-798-2627, that Medicare department can fix your primary, secondary issue. So very important. Now, just a couple pain points. Some people 65 or older become, ill while working. They lose their job. They lose their health insurance. Family and friends are uncertain about what they need to do to get covered. Now, I put this slide up because without authorization, you cannot help a friend or family member. So I always use this slide just to encourage people. If you don't have authorization with Medicare or Social Security to speak on a loved one's behalf, you need to contact them and say, my loved one would like me to be her authorized rep and vice versa, because I get calls from people all the time. I had one just earlier today. A gentleman is trying to help his mom change her plan. She has an HMO, which is just not working, a Medicare Advantage HMO. He wants to change her to a Medicare Advantage PPO because she cannot qualify for a Medicare supplement plan, but he doesn't have her Medicare number. So he can't find it anywhere. So he calls Medicare. Medicare says, put your mom on the phone, and he can't put his mom on the phone. So again, it's very important that you have authorization at both Medicare and Social Security, the insurance company, the doctor's office. Make sure you always have that authorization on file, because otherwise you will not be able to help your loved one. The reason I have this next slide up, if you decide to replace your employer plan or you already are on a Medicare plan, again, Medicare Advantage plans are based on your zip code. You're not in Hawaii, that's okay. We only have 7 plans, but I do work with people in California, Nevada, Utah, all over the country, and other states have way more than 7 companies. But in Hawaii, we just have 7. But regardless of the number of companies, Medicare plans are based on your zip code. So if you live in Utah, you will not have the same plan options as somebody who lives in Nevada. If you live in Nevada, you have different options than what we have here out in Hawaii. So a lot of times people are watching commercials on TV, or, they're getting really good with the Google. Sometimes they're using AI, and AI is giving you totally incorrect information, because if you don't know to put in your zip code, it doesn't know where you live. So a lot of plans and features are incorrect because the zip code is not there, and that determines what plans you have available to you. Now, a lot of people think that there are thousands and thousands of Medicare options. There's maybe thousands of different combinations and with different insurance companies, again, all based on your zip code. But the reality is, here are your Medicare options. You can have original Medicare Part A and Part B with a standalone Part D drug plan. You can have original Medicare Part A and Part B with a Medigap plan and a Part D to pick up your drugs, because medications that you pick up at a pharmacy are not covered by original Medicare A and B. They're not covered by your Medigap plan. Whatever you pick up from a pharmacy, you need to have your Part D. If you don't have your Part D, you miss it later on, penalties. Okay. I can tell you 2 million people, you're like, why is she bringing that up? 2 million people are paying Part D penalties, and they will pay as long as they have Medicare. 800,000 people are paying Part B as in Bravo penalties, and they'll pay that for as long as they have Medicare, because they got something wrong. So because the Medicare information is kind of sparse. Part C, Medicare Advantage plan with a Part D, can be an HMO or PPO, is another way to get your Medicare. And sometimes people have access to retiree Medicare plan options, which work totally different once again. So depending upon how you get your Medicare will depend, how it's going to work. I had a call from somebody from your support group, and this person, was in that situation. They had a plan that wasn't really covering them well for their diagnosis, and they were able to get onto their spouse's plan. And but the kind of the plan, the way it was kind of worded, it was kind of it was not clear whether it was a Medicare supplement plan or a Medicare Advantage plan. And it turns out that this group plan for retirees was some kind of hybrid that you don't often see. But we went over it, we talked about it, because this person doesn't want surprises. It's tough enough having a really difficult diagnosis, but we were able to determine exactly how that plan would work, but it was not a true Medicare supplement plan. And it was so important for this person to know that, because when you say Medicare supplement plan, well, we all know how, those of us that may have it knows how it works. If you have a plan F, Medicare pays first. Your Medicare plan F pays everything. You just pay your monthly premium. But this hybrid, which was actually an Advantage plan that was called a Medicare supplement Advantage plan, it was some kind of hybrid. So it was just good for this person to understand exactly how it's going to work. And I went through, it was a California plan, and I went through the entire 120-page booklet, and I did a little 1-page infographic, but we were able to determine it was not a pure Medicare supplement plan. And I'm so happy I was able to help with that. Okay, so next slide, I think, is just my slide thanking you and opening it up to questions. So since, oh, son, I need you to get me this next slide. Sometimes I have trouble with the slides, but that's pretty much the end of my prepared remarks. I have a couple more slides, but they're not, unnecessary to our discussion today. So I'd like to go ahead and open it up to questions. Yeah. Did have the questions all been answered?
Hi, Martha. Thanks for that. I do have a question. My head's spinning, and I have about a year to figure this all out. But So I guess what I was hearing, I'm learning a lot, but I'm learning and it's important. So thank you for all your clarifications, and even though it's overwhelming me right now. But anyway, I'm 59 and I'm on SSDI. And I heard that if you're on SSDI for 2 years, then you're eligible for Medicare. But then I heard last week somebody said, oh, with pancreatic cancer, that can even be sped up. So I just wondered if you knew like how that applies for someone in my position.
Yep, that's an excellent question. People do qualify for Medicare younger than age 65, which is the one due to age. If a person applies for Social Security disability under normal circumstances, in the 25th month of receiving payments, you will automatically be sent a Medicare Part A and Part B card, and that would be your time to pick one of the options. But there is a compassionate allowance for folks with pancreatic cancer, and they do speed up the process for qualifying you for disability. However, it all depends on your case, whether that will speed up the time for getting the Medicare Part A and B. So you would need to reach out to Social Security Disability to see when they have you on track for your Medicare. Many people, when they qualify due to a disability, the 24 or 25th month, they start from when you applied. So even though it may have taken a while for your case to be fully settled and approved, they go back to the date you applied. So you should start counting the 24 months if that's what you'll be under, and the 25th month, they will send you a Medicare Part A and B card. But if you've not received that card, I would say you need to reach out to Social Security and ask them when would you expect to receive your Medicare Part A and B. Again, the reason why you're getting the different answers is because sometimes it's determined by a case, and your full case needs to be reviewed to determine if you're somebody who will indeed qualify with everyone else at the end of 24 months of payments.
So have you ever heard of it being shorter than 24 months?
For people with end-stage renal disease, yes, yes.
And what about pancreatic cancer?
No, I've never heard of it sooner for someone with pancreatic cancer, but it's
Okay.
not something that I was ever asked about. Mhm.
Okay, thank you.
You're welcome.
If
Well-
someone doesn't feel comfortable asking their questions, feel free to put it in the chat.
Yeah. And I just want to say, I know that this information can be overwhelming, and especially when I speak, I have to speak in very general terms, but I am open to texting me or emailing me, and I'm happy to review things for you and give you answers. I actually enjoy navigating Medicare and digging deep to find answers. If I don't know the answer, I'll find it for you. And I am an avid reader of what's called the Federal Register. So I know why these decisions were made and why the program looks the way it does today in 2025. But Medicare actually was signed into law in 65. First cards went out in 1966. So it was former Truman, who actually is considered the grandfather of Medicare as we know it today. And he started putting this program together in the 40s. And 2025 is not the 1940s. So this is the reason I believe everyone needs a go-to person and a resource that really understands Medicare, especially when you're dealing with a diagnosis of pancreatic cancer. You got to have a go-to resource who really, really knows and knows how to get the answers. Unfortunately, I can't say insurance companies pay for this, but it's certainly needed, certainly needed. And so I'm so happy that, I volunteered to be a resource for all of you.
Yeah, and this is Roger, and I just want to say thank you, Martha. Martha has helped a lot of I'll call them family members of the Seena Magowitz Foundation, and it's just a resource we try to provide. just because, just like Martha said, so much is overwhelming, just like in your case, Jeanette. You're being overwhelmed with so much, and now you're trying to navigate Medicare. And that's why I feel we're fortunate that many of our folks have contacted Martha, text, email, phone calls, and she's been able to try to navigate the system, for them. So I just wanted to say thank you, Martha. But when she said she's available, she is. I'm sure, like anybody, one day she might be busy, but you'll definitely get answers. And the beauty of it is, where do you go for these answers? That's the $1 million question. And so at least we have a resource. And like Martha said, she's licensed in 40 states. And I'm sure after a while, a lot of these questions are repetitive. But honestly, when you're in the throes of pancreatic cancer, the last thing you want to do is now worry about your Medicare care. So and that's why we did it, just to add another resource to the foundation.
I think Keith has a question.
Yep. I'm in the same situation as Jeanette in that I'm a little older, but I'm under 65.
Okay.
And so I was actually diagnosed in June of 2024, but they retroactively, I'm looking at the letter I received from Social Security. They retroactively said that I became disabled on January 1st of 2024, which means I'm eligible for Medicare on January 1st, 2026.
Yeah.
Based on what you just said, though, Martha, is that you have to wait 24, 25 months from when you start receiving your disability payments. That doesn't jive with, I guess I'm a little confused.
Yeah, no, that's not what I said. What I said was, that was exactly, I'm so happy you brought this up, because that's what I was highlighting, that even though it may have taken a while for you to get the, approval, they go back to the date of your application. So it starts from the date. So you're right. You're eligible January 2026 for Medicare. So they should send you a card, and this is what you should have: a card in the mail or on the way, and it will say 1/1/2026 if you were
Okay.
approved 1/1/2024. So that's what I was noting, that it's 24 months to 25th month, but they go back to the date of the application.
Okay, so even though I didn't apply until June of 2024, they said I was disabled as of January 1st, 2024.
Okay, so there's
basis,
a difference.
yes.
Oh, so that's the difference. Yeah. So they went back to January, but you never even applied till June of 2024.
Correct.
Oh, okay. So I can check on that and get back to you, but based on what I do know, then it would be from June 2024. Your payments
Okay.
started June 2024? Is that when your payments, did they retro you back?
Yes,
Your
that's
payments
correct.
to June, not January.
Correct. But
Okay.
like I said, I'm looking at the letter
Right.
and it actually states in here, let's see, we found that you became disabled under our rules on January 1st of 2024.
Okay. But your actual disability payment started June 2024?
Correct.
Oh, okay. So I will check on that, but based on, what I know, typically you would qualify June of 2026. But I will check on that and then
Yeah.
make sure.
And it's very important because I can't be without insurance.
Oh,
And
of course.
yeah.
Yeah. Of course. Yeah. But I'm happy that you're close. You're getting pretty close.
Yeah.
So if you get, like Michael said, that Plan F is like awesome. Well, Plan G, you don't qualify. You won't qualify for F. Sorry, Plan G is awesome for what you need.
Yep. I actually sat with someone today and went through that, and it
Awesome.
looks like what I need. The biggest concern that I have is really with Social Security and, well, with Medicare.
Right.
I just don't want any gap, no pun intended.
No, you don't. No gaps. You don't need any
Okay.
gaps. Absolutely no gaps. And
Perfect.
what's pretty nice is that even, let's just say it is June, you could actually, what was that? Yeah, once you get the Medicare card, even if it's a few months before you qualify, you can fill out all of your forms 3 months ahead. So the first day of the month that your Medicare A and B start, you'll have your supplement plan, you'll have your card, you'll be all set to go.
Okay, do I need to fill out a bunch of forms with Social Security, or is it automatic issue?
Oh, it's
For Part
automatic.
A and Part B?
It's
automatic
automatic
issue?
because you have disability, correct?
Okay, perfect. Thank
Yeah.
you.
Oh, you're
Um,
so welcome.
how,
But
how
that's a
do I
great
reach?
question.
Yep. How do I reach out to you, Martha?
I have, I can put, you can just, I have a number 808-230-3379. I do give out my personal cell.
Okay.
I
What
know.
were
I'm
those last four? Yeah, what were those last?
3379. And you could text me
Okay.
on number as well. And then I'm in Hawaii, so I don't know what state you're in, but 3 hours behind.
Wisconsin, we've got
Oh,
quite a
Wisconsin.
time difference. I won't bother
Yes.
you early.
Oh, no, it's
Thank you.
okay. But I really do enjoy navigating and helping. Excuse me, I'm sorry, I'm on a Zoom. I'm on a Zoom. Hi, I'm on a Zoom. You gotta go step outside. Yeah, but I really do enjoy helping people navigate these questions because that's an excellent one. The letter pushes me to January 1, but my payment started June. So am I, June 2026 or January 2026? That's excellent.
I
Thank you.
hope it's January. Thank you.
Yeah.
And I did put Martha's contact information in the chat, so if anyone needs to reach out.
And please do, don't even think twice about it. Please reach out because sometimes a person has a question and I'm able to, give them an answer that really, really is helpful. And I don't mind. I do a radio show every week, and as Miranda said, I do other things, and I build the shows based on the questions. So then I get a lot of fantastic feedback because people say, "Oh, that was my question. No one's ever answered it before." So I love when people reach out to me, and Keith, thank you for this excellent one because that's one I've never had before, and it just keeps the shows relevant and Medicare is boring, but it keeps it relevant when I'm able to share what is actually on people's minds. So that's why I'm very excited about Medicare and I love it. I absolutely love it. It's so nuanced. It's like, what? Some of the things are just don't make any sense at all. No sense, but it's okay. I have been able to solve problems, find solutions. And I know this one doctor, she calls me and she goes, Martha, I have a bill. It's $1.2 million. And she said, I was going to have a stroke, but I remember you said, if there's a Medicare question, call Martha first. And so she called me and she had a Medicare Plan F supplement. And so she should not be getting a $1.2 million bill. But what happened is her husband's also a doctor. He ended up being in the hospital for 400 days, 400 days. Okay. So the hospital knows that Medicare only covers a certain number of days. So rather than putting through the claim, they just decided that, pay us $1.2 million because Medicare won't pay. But she had the supplement plan. So we call the supplement plan. Supplement plan says, well, we can't pay until Medicare bills and gets the denial and then we'll pay. So I had to get the hospital on the line. I got the supplement plan on the line and we got, okay, can you bill? But it's going to be denied. No, it's okay. We like a denial because denial means the sub will pay. So the hospital billed, it got denied by Medicare, supplement paid, $1.2 million went away. And this is about to be sent to collections. So she told me she'll talk to anybody and she will tell them that she was going to just have a stroke. And I was like, no, never have a stroke, But she said that is how distressing it was because she's a doctor. She had already called the hospital. She had already called the insurance company many, many times. And they said, sorry, it's going to collections. And that's when she called me and we were able to work it out. I was able to look at it like, yeah, this should have been paid. So that's how I realized, the hospitals say, we don't bill because Medicare doesn't pay over X amount of days. And then the supplement says we can't pay till we see the denial. So see, it's just one of those things. If you have a condition or your spouse is ill, who's sitting there trying to think about how this thing might work? So I focus on solutions. So whatever somebody brings me, I take great delight in finding solutions. So feel free to reach out.
Okay, so quick question, if we're done, or if I can ask.
Yeah, sure.
Okay, so good question, Keith, because my husband has pancreatic cancer. He's 59. and he's getting SSDI benefits. And so that's great that you're automatically enrolled, right? Is what you're saying, but you have to fill out some forms, and you'll get a card, I guess, a few months before the 24 months is up, right? Is my understanding?
Right. So wait, so what did you say? I'm sorry, could you go back? Because I heard forms.
Okay, so he's 59.
Yeah.
Right.
59.
You're saying that he should get a card, right, in the mail or something to say that you're automatically enrolled. But then did you
Correct.
say that we also have to fill out forms as well,
No.
or no?
No, the 24th month of receiving his disability payment, a few months before that, typically 3 months before, he should get a letter and the Medicare card, Part A and Part B.
Okay, but do you have to select that Plan G? Like, is that something?
Yeah, that's separate. Once you get that card in the mail with the Part A and B, because you cannot enroll in a plan until you have the Medicare number. So once you get the
Okay.
card, then that's when you pursue picking up that Plan G as in girl.
Okay, great. Okay.
Okay.
So second question was, because you have pancreatic cancer, we might be looking into clinical trials. So can you touch upon how Medicare works in paying for some of the costs of the clinical trial?
Yeah, that's an excellent question. And of course, I don't know which clinical trial your husband might qualify for, but of the patients that I have been talking to in different clinical trials, it's completely 100% paid for.
Oh, okay.
Only thing you pay for is when you have services outside of something related to the clinical trial. So if you need to have, a blood draw related to something else or a scan related to something else, that's where your insurance comes in. But the clinical trial, everything was covered 100%. But of course, you have to look at the details of that particular clinical trial, and they typically will tell you, what is going to be covered. So you understand that not everything will be covered. Yeah.
Yeah, but that's the clinical trial covering, but Medicare will
Right.
cover like the CT scan or any kind of,
Right, if
like you're
it's not
saying,
part, correct.
if it's not
That's
part of it.
correct.
Okay. Okay,
That's
great.
correct. Yep,
All
that's
right.
correct. And that was exactly this person who reached out to me a couple weeks ago. If she found out UCLA, actually UCLA has their own Medicare Advantage plan now. I was like, wow, that's weird. They would drop all the Advantage plans because UCLA created their own Medicare Advantage plan last year. I was like, what? And right now they have 4,000 people in it. So I guess it will grow since they dropped the other Advantage plans. But anything she wants to have outside of the clinical trial, because they don't accept her Advantage plan, she has to pay out of pocket and get reimbursed.
Okay, repeat. I missed that. Why does she have to pay out of pocket if?
Because UCLA no longer takes the Medicare Advantage plan that she has. So she
Oh,
has to
okay.
pay out of
But if I went
pocket
with
and her plan
original,
reimburses.
now if we went with the Plan G, which is the
Yeah,
original
that's
Medicare,
different.
that would be
Yep,
covered, right?
that's correct. That's correct.
Okay.
Yep.
Okay. So wouldn't it make sense to kind of stick with the original Medicare, or are there certain
And the Plan G,
and
yes.
the gap, right?
That's correct. Yes, it would. Yes. So
Okay,
that
great.
diagnosis,
Because I don't
that,
want like to have to worry about looking
that's
things
right.
up and
Yep. That's
okay.
the best thing you can have. Yep.
Okay, great.
Yep.
Thank you.
Yep. Guess we're good.
I think so.
Anybody
Thank
else
you
have
so
any
much, Martha.
questions? Michael, you don't have no more questions?
I was just going to say, Martha, this is, I did, which everybody else doesn't care about. I did federal crop insurance for years and years and years. And the intricacies of their rules, I thought were really incredible. And for you to understand Medicare and Medicare Advantage and these things like you do makes me look like I was in a sandbox playing with marbles. You're just doing a great job. I'm incredibly impressed with your knowledge in this area, and you're really helping a lot of patients. And I'm going to be keeping your information to hand it out to people. In fact, I had to go off to talk to somebody, and I said, I've got a number for you.
They
It's
call me
real.
Medicare Martha.
Michael, with the clinical trial that you were on at Honor Health, being on Medicare, everything was paid, correct?
I have been 7 years on the clinical trial. And with regard to, the clinical trial and pancreatic cancer, so far, I have paid exactly that much. Nothing.
Yay. Awesome. Yep. It's the best.
Yeah.
Yeah.
Well, we certainly thank you, Martha, and I certainly would encourage anybody who had questions to reach out to Martha. If you lose her phone number, just call Miranda or myself or send an email to the foundation and we'd be more than happy to get it. And hopefully, the folks that were on the call, got some solid information. And if you have any more questions, I think you all know how to find us.
Okay, well, bye, everybody. Aloha.
Thank
so
you,
much, Martha.
Martha.
Aloha.
Thank you, Martha. Thank you,
welcome.
everyone.
Bye.
Bye.